So, you were mentioning about the treatment protocol. It has to be ideally centered around Jwara chikitsa. So this
Yes.
clearly also says that we can't have a general one or two solution for this COVID-19. So that has to be
No.
individualized.
Yes,
So
it has to be. It's true that we have to customize the treatment according to the individuals. It's not that we have, one or two medicines. That's the thinking that comes from modern medicine, where you have one antiviral drug which we give to everybody, or a vaccine that you can just distribute to millions of people, and the disease is solved. Because Ayurveda focuses on host related factors, we need to follow a treatment algorithm which has to be customized. But on the whole, we do have a generalized protocol. As I said, some of us worked on this COVID-19 profile. I was the first author of a paper that was published on clinical profiling of COVID-19. And we looked at data at that time. This was in March, April, when Medanta was one of the few institutions which had a cohort of COVID-19 patients. The doctors there were quite open and shared all that data with us. So looking at that data from real patients, literature review of modern, research papers, and then classical Ayurvedic texts, we looked at fever, Rajekshma, Kasa, Ashwas, all these diseases, which are related to respiratory illnesses. We came to the conclusion that COVID-19 can be categorized as an Aganduja, which
what?
Aganduja Jwara means, a disease caused by an external factor. There is an external agent, which is the primary cause of that disease. And specifically, Aganduja Jwara is also classified into many categories. And we found that Bhuta abhihangaja Jwara is that particular type of Aganduja Jwara which matches with COVID-19.
So what is meant by Bhuta? Can you just
Yeah,
explain
so
in detail?
Bhuta, yeah, Bhuta actually means a living being, a living organism. That is what Bhuta means. So many meanings are there. But Chakrapani Datta in the commentary Sharirasthan of Charaka Samhita, so he clearly says Savishakrami. Bhuta means Savishakrami. So even Vishakramis are to be understood as Bhutas. So in diseases like malaria, where we know it is caused by a parasite, in Ayurveda also we have this concept, Kejit Bhuta Bishangotham Bruvate Vishamajwaram. So Shruda mentions this, that according to some people, fevers like malaria are caused by Bhuta Vishanga, or by the infestation of a living organism. There is a parasite. So Bhuta Vishanga Jwara means a disease which is caused by a Vishakrami, or a virulent organism. And that leads to a chain of events which results eventually in dosha imbalance. So in the first phase of the disease, we may see only Hetu Vyanjaga Lakshanas, which means Hetu Vyanjaga means the Lakshanas or symptoms which indicate that there has been an invasion or an infection by a virus. But it has not led to dosha imbalance or, disease specific. A samprati has not yet developed. So in that stage, yes, in that stage, in fact, in many people, they remain in this stage and they recover. It never becomes a Nija Vyadhi in many individuals. COVID-19, we can see that. They are asymptomatic or pre-symptomatic. They get some mild symptoms, and by the time it becomes an established dosha adhisthita vyadhi, a Nija Vyadhi, it doesn't progress. It just disappears. So this is also clearly mentioned by Chakrapani, that a disease may remain up to 7 days or 10 days, it may remain purely as an Aganduja Vyadhi. And unless it is able to induce a doshic imbalance, it cannot persist or continue as a Nija Vyadhi. So in that initial stage, while the disease remains as an Aganduja Vyadhi, our entire focus is on strengthening the host factors. We are not doing a disease-specific approach. But the moment the Nija Lakshanas, which means dosha Vyanjaga Lakshanas, that is signs indicating an imbalance of the doshas, are seen, then we have to do treatment which is specific to the doshas. So this is why, even generally speaking, we need to know which phase the disease is. Is it in the Agandu phase or is it in the Nija phase? If it is in the Nija phase also, different individuals may respond to the disease in different ways.
Sir, what are the different phases or different presentations that we can have? Which could possibly manifest itself in the Nija phase or the intraneous or the Nija Vyadhi phase.
Yes, I mean, there was a paper published by some researchers from King's College London, in which they have now given a classification of COVID-19 into 6 clusters. It's the first time that even from the modern side, they have done a very careful clinical classification of the disease. So this ranges from symptomatic to very severe, the focus on respiratory system or on the digestive system, other external manifestations. We have heard of very strange symptoms like COVID toes, inflammatory change. Yeah, yeah. So, and also inflammatory changes, which can also be seen in the hands apart from the feet. So these kind of presentations show that the host response can be quite varied. Now, in my understanding, for Shwasa Kasa, in Ayurveda, we have said that Amasya Samudbhava. Kasa Shwasa has a root in the gastrointestinal system. And this link is probably the reason why we are seeing 2 focuses basically in COVID-19. In some people, there is initially a gastrointestinal disturbance, and then later they develop, respiratory symptoms. So in others, it's primarily happening only through that, or the gastrointestinal symptoms don't really manifest, but that doesn't mean that it's not involved.
It is not affected.
So urastha kurive shwasam amashaya samudbhavam. So when a shwasa samprapti is involved, the koshta can also be actually associated. So this is why we see these 2 kind of focuses. Now the thing is, it's quite clear that the substratum of the disease is the respiratory system, which according to Ayurveda is the seat of kapha. Uras is the seat of kapha. The second dosha that is dominating here is vata, because it is a sthana of udanavada, it is a sthana of vyana, all these things. So it is a vata kapha sthana. That is the reason why the Jwara, when it manifests, it shows the features of a vata kapha pradhana Jwara, because the location is the seat of kapha and vata. But this virus is very virulent. It is like a vishakrimi, as Ayurveda would say. So vishakrimi means it's very tikshna, ruksha, and so if that virus is able to establish itself, then very soon it will dry up kapha and it can move into a pitta dominant condition. This is what we are seeing in the progress of COVID-19. So when if the virus is able to really establish itself, especially in the lower respiratory system, which is the seat of kapha, and because of its tikshna, ruksha gunas, all that kapha dries up. You can see that ground glass opacity in the X-rays, which is very typical of COVID. In fact, category 5, CORATS category 5 is considered to be diagnostic of COVID-19, even when the RT-PCR may be negative. So these changes are. So this kind of an attack is happening on the respiratory system. Because of a vata kapha dominance, even when there is this rakta pitta is happening, because of the tikshna nature of the virus, we see that it's blood clotting that happens rather than bleeding.
You were mentioning that the new diseases or new disease entities also can be very well understood with the principles mentioned in that. So, what are some of the principles which Ayurveda lays down, using which we can understand a new disease like COVID-19? Because COVID-19 scientists are saying that very little is known about that. So, in context of Ayurveda.
Yeah. Yes, new diseases have to be studied. And Ayurvedic texts also make this distinction between Ukta Vyadhis. Ukta Vyadhis means those which have been codified in the texts, and Anukta Vyadhis which are not codified. So the Charaka Samhita in Chikitsa Sthana, with the 30th chapter, before concluding He says, Nidana dosha dushyanam viparitam hitam dhruvam uktan gadan sarvan samyag yuktam niyachat. So this Nidana dosha dushya, these are the broad framework. This will keep changing. The way the agent host interactions happen change. And that is why different diseases manifest. So by studying these factors, we can understand the mechanism of even new diseases. This is what Charaka is telling. In another context, Charaka himself, and this has also been echoed by Vagbhada in the verse Vikara Nama Kushalo Na Jihriyat Kadach. And if you don't know a disease by name, you confront a new disease, you don't need to feel ashamed because nahi sarva vikaranam namadosti dhruvasti. It's not just by nomenclature that we understand a disease. So even if it's a new disease, saeva kupito dosha, we have to understand what is the dosha imbalance that has been created by the disease. Samuthana visheshata, what specific causative factors actually caused its provocation. And sthanantaragata, which regions in the body, which organs, which dhatus are actually involved in the manifestation of this pathology. So avastha visheshas, like what all the different stages through which the disease progresses. So all this need to be studied. So even from an Ayurvedic point of view, I mean, no Ayurvedic physician can say that we know everything about COVID again. We also need to study it, but we have our framework of understanding. Modern medicine, they are, and we can also use a lot of descriptive, findings from modern medicine and interpret it from an Ayurvedic framework and gain deeper understanding of the disease. So that is the way we should be proceeding.
So, this also answers why the modern understanding of the disease and modern treatment protocol cannot be exactly adopted to Ayurvedic treatment protocol, like use of antimicrobial drug. Like this.
Yes. I think the fact is in modern medicine, they are trying to look at two mechanisms. One is creating, from a preventive point of view, inducing or stimulating the body to produce specific antibodies that are specific to this virus. There are challenges because now I was looking at the CDC and FDA, advices about how long after getting an infection a person can be immune to a second attack. So very little is known about this. They are not even able to guarantee that you have an immunity for 3 months after you get an infection. So we do not know this kind of antibody specific, mediated immunity, whether it's even possible for COVID-19, because that's one of the targets of modern medicine, to develop a vaccine and to induce the body to produce antibodies that are very specific to this virus, and then you will not have an infection because when the virus comes, the antibodies will destroy it. Another mechanism is antiviral. Develop an antiviral drug which can interfere with the life cycle of the virus before it enters, because the virus begins to multiply only once it enters a living environment, otherwise it cannot. So here one of the ways is to prevent cell entry. The second is preventing the virus from hijacking the cell DNA, the genetic material, and then replicating itself. Then after replication, the virus ejects all these new viruses out of the cell. So in any of these phase of the cycle, an antiviral drug can come and interfere. But in modern medicine, we don't really have magical antiviral drugs. For a viral infection, they usually say it's the body that has to actually, fight and win the battle. So for these two reasons, while you cannot say that modern science shouldn't do research in that way, it is worth continuing research. Let that happen. If we are able to discover an antiviral drug or this magical vaccine, it's well and good. But in Ayurveda, the whole focus is different. We are focusing on host factors, which will enable the individual to not prevent the disease completely, or just destroy the virus through. It's a process through which the body overcomes the disease, even by going through a mild infection. There may be a mild infection. But if your immune system is really strong, you are asymptomatic, but you are still infected. Or you get a mild infection which doesn't really progress into a severe disease. So Ayurvedic focus would be in these two areas. So I don't think we can expect Ayurveda to produce a vaccine or a magical antiviral drug. But we do have enough, conceptual understanding as well as the medications, a large number of formulations. We cannot pick one or two of them because my interactions with experienced clinicians have revealed that it has to be used as an algorithm based on the condition of the patient. We can pick up and choose all these medicines, and then the results. You see the results clinically.
So, there are also many cases wherein people are, of course, they have contracted the infection, but for months together they are asymptomatic. Yet they are not turning COVID negative also, but the infection is still there in the body. If we have to look at that in the modern perspective, so
Yes,
that
this is
also.
yeah, the hetu. This is what Ayurveda nidana dosha dosha visha. This interaction go on for some time. So depending on the way the strength of these factors are aligned, the hetu, the hetu may persist, but it may not be able to produce a
True.
disease. Similarly, we are seeing people who have recovered are testing positive for a long period of time.
Again.
This is also seen. So, which means now the dosha dhatus, those factors have become strong. So, even though the hetu is there in the body, it's not able to produce a disease. So, it could be either pre-manifestation of the disease, patient may be totally asymptomatic, or patient may be asymptomatic after recovery, but they are still testing positive for COVID-19. But the good thing is that they are not expected to be contagious in that stage. There is still no very clear understanding, but that phase in which they are contagious it's a very small window. So that's some good news. But the problem is that even asymptomatic people in that window can actually spread the disease. So that really creates a lot of panic and difficulty in curbing the spread of
Control.
disease. Yes.
So also, when we talk about the mode of transmission, there is something called as Aupasargika Vyadhi, that is by the very contact or Upasarga. So Dalhana even mentions Jwara by Upasarga. So can we restrict it? Is it just the droplet, or Upasarga has a broader sense to it,
Yeah, I mean,
just by the association?
yes, Sushruta very clearly mentioned Prasangad, Gatra Samsparshad, Nishwasad, Sahabhojanad. So all those factors have been very well elaborated in the Sushruta Samhita, all these modes of transmission. In the case of COVID-19, it's not yet very fully understood. What are the modalities through which it is and in which phases it's actually being transmitted. There was even a transmission in air through air was also hypothesized sometimes. But at this point of time, the dominant theory is that it is predominantly spread through droplets, and which is why wearing masks are said to be the safest way. And there is also an understanding that in hospital environments, in air-conditioned rooms, there is if there is an aerosolization of these droplets, like with that can happen when you are intubating a patient using a nebulizer, then the chances of spreading is really very high. And there is also some understanding that there is a nasal carriage of the virus, that it remains in the nose, the nasal epithelia. There are some papers that appeared also in the Nature magazine in which researchers found that if the virus is facilitated by the epithelium of the nose, cell entry is facilitated. Similarly, in the oral mucosa also, so the oropharynx as well as the nasopharynx are very key entry points that even eyes are considered to be a entry point. So if we are talking a lot, two people are talking, it does if contact, physical contact is not necessary. I mean, if you are within a certain proximity, That is enough for this to happen. But what's interesting is that in the prevention, there are increasingly information coming that if we are regularly doing nasal rinsing, oral rinsing, it can prevent the spread of the disease, not cure the disease. The viral load in the nasal passages as well as in the oral cavity can be reduced by doing simple practices like even hypersaline solution for nasya, hypersaline solution for gargling. So if patients do this, if medical personnel do this in hospitals, povidone iodine has been recommended. And one of my colleagues, Dr. Vijit Shashidhar, he is a practitioner in Vaikam. He came up with a very interesting reference in the Yoga Ratnagara, where for Sanipada Jwara, they have mentioned a Nasya and a Stivana Yoga. Stivana means speech. So, yeah. So this is actually made of some simple citrus fruits, trikatu, and they make it into a solution. And this Nasya and Kavala has been described in the Sanipada Jwara, which is very similar symptoms, respiratory symptoms. So that was quite fascinating. And when we did some docking studies of the herbs, it was found that they have compounds which can actually, block the virus from entering into the cells. So all this shows again that the insights in Ayurvedic texts are sometimes very profound. So definitely, if you are practicing hygiene of the nose, in Sushruta Samhita, it has also been mentioned that when you are going out, you should do nasya and then move out. So this is again, there's some foresight that they had about how infectious diseases could spread and what measures you have to take to prevent this from happening.
So the very brief idea of a superficial idea of prevention could be reducing the kleda or the unwanted moisture inside the
Yes, because
oropharynx.
this is all part of what Ayurveda would call as Prakriti Vikhada. Krimi chikitsa, Prakriti Vikhada is you know, not providing the kind of favorable substratum for the krimis to multiply and spread inside the body.